This is Porch Talk Doctor, and I'm Dr. Scott. Today we're going to continue the conversation on how to have hard conversations. First of all, I'm driving right now.
So that's hard to have conversations.
It's hard to have a conversation when you're driving.
And my name is Shondell, and I'm going to be interviewing because my wonderful husband and CEO of our company has just had a 2-day streak of hard conversations, and we want to capture them for you. So, Scott, what is what is going through your mind when you're about to have one of these conversations? Because I think you had like 5 in the last 24 hours. Bless your heart.
I think number one, you really do have to make sure that your emotions are in check.
Yeah.
And so as long as you're really well regulated, meaning, you've done some self-care.
Yeah.
And I think doing some self-care before going into a pretty tough conversation that could get heated.
Yeah.
And even during a heated conversation, as long as you stay as regulated as possible and you remain kind, it's going to go okay. It really will. And it is okay. Don't get me wrong. It's okay to get a little heated sometimes.
Right.
You just don't want to lose control.
That's right.
And if you lose control, you've just lost the argument.
Yeah, and I think you did a great job. So I would say point number 2 is keeping the end in mind. Like, you had outcomes that you were focused on.
Right.
And
Absolutely.
how did that help you get through those conversations?
Well, yeah. Number one, I think when you know that an outcome that you want to have is that you want to maintain the relationship.
Yes.
And so knowing that, going into the conversation, knowing, okay, I really do want to focus on maintaining this relationship because it is important to me. And this person who is a person, and that we have to remember that they're not an object.
Yeah.
They're not somebody that we can just squash because we have an issue with what they're doing.
Right.
Or how they're treating us.
Or we feel wronged.
Or we feel wronged, exactly. Yeah. So as long as you know that, okay, this person probably has good intentions, they just need to be informed how they could maybe do things better.
Yeah.
Then you got the right end in mind. And I think going in with that attitude and that perspective is very helpful.
Yeah, and I think the third thing that I really noticed in the last couple days, bless your heart, is that you were willing to compromise. Like, there was compromise in the end. Would you say that that's true? Yeah,
I do. I think at times that's fine.
Yeah.
Because as long as you got your message across, and if you can end up, just like in a negotiation, if you can end up with a win-win, why not try to go there?
That's right. That's good. All right. So what I heard as we're finalizing this up, number 1, you got to have self-care and make sure that you are really in a good place.
Right.
Number 2, you got to treat the person like a person. So you cannot make them the bad guy, this evil person that's out to get you, this object. This is a person to be cared for.
Right.
And number 3, you got to be willing to compromise. Not that you're compromising your values or what's right, but being open to the whole story. All right. That's great. You want to close us out? Porch Talk Doctor.
This is Porch Talk Doctor, and I'm Dr. Scott. We'll see you next time.